Welcome back to Care with Candace. So I'm just getting off shift and I had some pretty disturbing things happen while I was there. We were working on trying to get a guy transferred to a skilled nursing facility, and usually our case manager gets those things situated, make sure that the patients have, oxygen or wheelchairs, walkers, whatever the case they need, situated before going to the skilled nursing facilities. This particular time, we were basically denied by the facility, and when we asked why, they told us that they were not accepting patients anymore due to low staffing. And that was kind of shocking to me because I didn't think that it would come to that point. But when I did some research, I was actually seeing that a lot of nursing homes are actually starting to close down because they don't have the adequate staff to take care of these patients. This is obviously a place where elderly patients will go if their families cannot take care of them. It's supposed to be a safe place for them to go, maybe for their end of life. So the fact that they are so short-staffed that they cannot accept new patients, or they're waiting for someone to pass on in order to have an opening, is really unfortunate. And I feel like as nurses, we often forget that there are other places that patients live outside of the hospitals. Geriatrics is actually pretty near and dear to my heart, considering the fact that I started as a CNA, or a PCT rather, in the skilled nursing facilities, and also as in their independent living situations as well. So they were still partnered with nursing homes, but they weren't in their direct homes that, they raised their families and stuff. So when I was there as an aide, just helping them out on their normal activities of daily living, I noticed that the nurses there, they would have one per floor, and they could have up to 20 to 30 patients per floor. Or they'll have CNAs, but there'll only be maybe 2 for that entire 8 to 12 hour shift. So it wasn't that I was necessarily directly working with the nursing homes. I was with the home care agency, so we would pop in and out, but from what I've seen, not my specific patients, but from other people, I've seen unfortunate situations where those patients did not get a chance to be cleaned up that day, or did not get to a meal because they were either forgotten about, or there just wasn't enough staff to get them to where they needed to be. And obviously our family members are sometimes put in these situations to be taken care of, and we're trusting the facility to do so. But if we don't have the proper staff, then sometimes tasks are not done. So I think we should, as nurses, remember that care does not stop when we are in the hospitals. People either go home, or sometimes people go to nursing homes, and nursing homes need help too. So as a new grad, consider that when thinking about where exactly you would like to work. It might not be ideal for a lot of people. And it might be very routine, and not a lot of diversity in care, but it's an area where staff is definitely lacking. Obviously, we lack nurses in the hospital, but also think about the end of life or the elderly population. They're not getting what they need as well in the nursing homes. So take that into consideration. Also, experienced nurses too, take that into consideration when you might get tired of bedside and we're looking for something else to do, something a bit more consistent, lower intensity, less stressful. That may be an area of interest to you as well. So send this to a new grad, send this to a current nurse who might be kind of done with bedside and interested in kind of turning around and doing something different in nursing. This might be an area that you're interested in. So leave a comment, share, subscribe, and obviously there will be more content coming. All right. Thank you.